students, welcome back to my channel. It's me Shafaq. To like and subscribe my channel, and let's start today's lesson. Today we are going to learn about the pectoral region. The pectoral region is located on the anterior chest wall. It contains 4 muscles that exert a force on the upper limb. Names of the muscles are Pectoralis Major, Pectoralis Minor, serratus anterior and subclavius. First muscle here, Pectoralis Major. It is the most superficial muscle in the pectoral region. Here you can see a large and fan-shaped muscle composed of a sternal head and a clavicular head. Clavicular head originates from the anterior surface of middle clavicle, and sternal head originates from the anterior surface of sternum, the superior 6 costal cartilage. Upper 6 ribs will insert on the lateral lip of intertubercle groove of humerus. Its innervation, lateral and medial pectoral nerve. Its action, the clavicular head flexes the humerus, and when the arm is in flexed position, the sternal portion of Pectoralis Major will perform extension of humerus back to the anatomical position. But when they work together, they perform adduction of humerus and medial and internal rotation of humerus. Next muscle, Pectoralis Minor. The Pectoralis Minor lies underneath its larger counterpart muscle, Pectoralis Major. Both of these muscles form part of an anterior wall of axillary region. It originates from the third to fifth rib and insert on the coracoid process of scapula. And it stabilizes the scapula by drawing it inferiorly and anteriorly against thoracic wall. Next muscle, serratus anterior. It is also known as boxer's muscle. The serratus anterior is located more laterally in the chest wall and forms the medial border of axillary region. Here is a boxer, and this muscle consists of several strips which originates from the lateral aspect of first to eighth rib, and it will insert on the vertebral border and inferior angle of scapula. Like this in strips. Its innervation is long thoracic nerve. And its action, it rotates the scapula, allowing the arm to be raised over the 90 degree, and it also holds the scapula against the rib cage. Next muscle, subclavius. The subclavius is a small muscle which is located directly underneath the clavicle running horizontally. It affords some minor protection to the underlying neurovascular structure in cases of clavicular fracture or other trauma, and it originates from the junction of the first rib and its costal cartilage. Insert into the inferior surface of middle third of clavicle. And supplied with nerve to subclavius. And action, it depresses the clavicle. The subclavius protects the underlying brachial plexus and subclavian vessel from broken clavicle. Now coming to clinical relevance, winging of scapula 1. On the action of the serratus anterior is to hold the scapula against the rib cage. If the long thoracic nerve is damaged and serratus anterior therefore paralyzed, a specific clinical sign is produced. The scapula is no longer hold against the ribcage and protrude out of the back. It is said to have a winged appearance. Long thoracic nerve palsy is thought to most commonly occur from traction injuries where the upper arm is stretched violently, like in hanging cases. So friends, it was all about the muscles of pectoral region. Thank you for watching.